I would want to know if there's anyone else in the family who has this. I would want to know if they're having associated symptoms, like are they having frequent falls?
And today we're going to talk about tall walking. And Judith, I've got a little nephew that sometimes when I see him walking, I see him walking just with the front part of his foot, a condition called tall walking. And sometimes when you scream at him to say, hey, why are you doing that? Then he starts walking properly. Is this something that parents need to be concerned about when they see their kids just walking with their toes? Is it just because they're being fanciful, or is there just like a serious condition that maybe that needs to be treated?
It is a phase sometimes. So many children under 3 years tend to sort of walk on their toes. In fact, many kids who start out when they're just starting to walk, many a time will like be up on their toes. Um,
Right.
that we, see parents, they tell us about it, reassure them, and for many it goes away. There's another interesting entity called idiopathic toe walking. So idiopathic in medicine means we don't really know what causes it. So we acknowledge that we don't know what causes idiopathic toe walking. There are
Yeah.
a few theories and a few conditions that are associated with it, but that's another one. But for that one
Mhm.
explains, meaning the parent will normally bring in the child who either has been toe walking, walking on their toes since they started walking, or they recently started walking, but they're constantly on their toes, and sometimes they'll intermittently walk on the sole of the foot, like put the foot down and walk
Yeah.
and walk properly. But that's one of the entities. Then there are other conditions that we worry about when children start walking the toes.
Mhm.
A child was previously walking fully down and then suddenly
Right.
starts to go up. So that can happen in a few conditions. One of those is neuromuscular conditions like cerebral palsy.
Mhm.
It can happen in conditions like Duchenne muscular dystrophy. It can happen in kids who are now getting a bit of tightness in their gastrocnemius and their Achilles. So yeah, it
Yeah.
could be a benign thing, or it can also be pathological. Yeah.
So, at what stage do you start getting concerned that maybe my child needs to go for surgery to fix that problem?
Yeah.
Does it affect, in terms of, for example, if they're playing football, soccer, whatever, or netball, whatever it is they like to do, if they are constantly on tour walking phase, does it affect, their day-to-day living, or is it something that you just say, well, they're going to end up straight up adults, regardless of the fact that they have got this condition?
Mm. So it's important to listen to the parents when they tell you how
Mhm.
they started, how it's affecting the child, how they're worried about it, because it is from picking up that detail in the history that you can know if this is probably something benign that you're just going to continue to observe, or there's something
Right.
that you need to like intervene ASAP. So if a child, and I'm talking by a child, I mean a child is a little older. So if a child is 6 years old, they were previously fine. They were walking on the sole of the foot, like fully the foot is
Mhm.
down, and then they progressively start to walk up on their toes. Um, I would want to, I would want to know the circumstances surrounding how this all started. I would want to know if there's anyone else in the family who has this. I would want to know if they're having associated symptoms, like are they having frequent falls? Are they complaining of pain in the legs? Have they actually had any treatment for this before? Do they have any known medical conditions? All this information helps me narrow it down to let's watch over this, or let's do something right now. So still going back to some of the conditions that I mentioned earlier, if it's idiopathic toe walking,
Mhm.
we tend to see these kids to be relatively normal to sometimes having other behavioral conditions, but overall, like nothing crazy. And but then the history will sort of help point you to that. In most kids who are
Yes.
idiopathic toe walkers, sometimes there'll be a family history of toe walking. Sometimes we find that children who are idiopathic toe walkers also tend to be autistic. Not all of them are, but most of them are. So that's something we try to probe at to see if that's present, so that if the parents are not maybe getting the necessary care for that, they get to know, and then the child is then gets the right care. The other conditions that I mentioned are things like Duchenne muscular dystrophy. It's one of the conditions that is associated with progressive weakness in the muscles. It affects boys, and it will typically, sometimes it will present with, in fact, many times it will present with toe walking. But these kids will also be a child who's born completely normal, but then over time, the parents notice that their child is having difficulty walking or falling down too frequently or not keeping up with their peers, or their cuffs are really big. You know, all these other symptoms that they come with will help you know if it's something entirely benign or something to worry about.
What sort of tests do you actually perform to determine whether the patient has got an idiopathic toe walking syndrome, or it's just something that is maybe they just like walk like that because they've seen some cartoon and they're just trying to follow what that cartoon does on TV, you know, kids. So what sort of tests do you kind of do to kind of determine that this is actually a medical condition that needs to be fixed?
Most times, actually, all that you need is just a very good history and examine the child thoroughly to especially rule out a neurological condition. So if it looks like there may be more to the toe walking, then that's when you start to request tests. So one of the conditions I've already talked about is Duchenne muscular dystrophy. If you're concerned about this, if the doctors are concerned about this, then they'll get some blood work. And this blood work can help in testing things like creatine kinase, which is one of the things produced a lot of in muscles, which is produced in muscles. Is like 10s to hundreds folds more in kids who have, kids who are toe walking and also have Duchenne muscular dystrophy. So that helps, increase the index of suspicion. But then also genetic testing can be done because this is a hereditary condition. In other conditions, especially those where a child is toe walking but just on one side, it makes, especially if they're previously fine, it makes you think of neurological conditions. So neurological means anything that affects the central nervous system. Think the brain, think the spinal cord, think the nerves that are peripheral. So for that, we could get tests like the MRI scan of an MRI scan of the spinal cord, one MRI scan of the brain to see if there's a lesion that is predisposing to this. The other conditions like tethered cord. So tethered cord means part of the spinal cord is anchored down where it should be. It typically just swims in the spinal fluid in your back. But sometimes as a child grows, if it's adhering onto something, then it's trying to grow away, but something is pulling it back, and that can present. It can present with like toe walking. Yeah, so those are like the most common things I will typically do when you see idiopathic toe walking. When you see toe walking, we immediately think, okay, I hope this is non-neurological, and if it's neurological, then you get the relevant tests.
And how common is this condition?
Toe walking in itself as a presentation is something that very many parents, very many children come in with. So in the early years, we'll see them walking on their toes, and at that point, if you've done a thorough history taking and you've examined them thoroughly, and there's nothing that is pointing towards any pathology, then it's reassuring the parent. So that is common in that age group. We see lots of it. As they get older, then we start to really talk about idiopathic toe walking, and that is not so common, especially in my practice. But then again, if you're working in a center that sees lots of children with neurological conditions, things like cerebral palsy, things maybe brain or spinal cord tumors, think history of maybe spina bifida, and many more. Tall walking or equinus deformity is something that
Yeah.
we tend to see a lot of.
Okay. So when you've made a decision now to say, okay, we're gonna treat this, what sort of treatment alternatives do you have? And I would like you to just maybe touch on whether you have some non-surgical interventions plus and also the surgical interventions that parents maybe need to be aware of what the treatment options are.
So the treatment can be both surgical and non-surgical, like you've clearly alluded to. So in the non-surgical treatment, it involves physiotherapy. So in the physiotherapy,
Right.
we recommend, and the children are taught stretching exercises for their gastroc and for their Achilles tendons. There are some gait training exercises that are also recommended, and the children are taught to do that. And also like psychotherapy. In the other things that are done in the non-operative treatments, it's footwear modifications. Sometimes the kids are given shoes with like a high top, and that's
so like shoe lifters, more or less. Yeah.
they're not. You see like all stars, the sneakers that are like high.
Yes.
So like
Yes.
so it forces them to like keep the foot down low. While if they're like
All right. Okay.
if they're like really short, like if the back of the foot is really short, sorry, if the
Right.
back of the shoe is short, then the it's not like comfortably hugging the foot enough, and they also keeping up on their toes. So that the interesting thing that even with those shoes, many of them will still walk on their toes. And it normally.
So in that instance, is it more like a psychological thing that maybe they kind of used to walking their toes? So even though they're wearing these shoes that help them to fix the condition, they still go on to walk the way they've been walking for long. Is that the reason why that happens?
Yes, and I think when you asked about treatment, the first thing I should have mentioned was that everything we're doing in this case sort of just trying to break the cycle. We're trying to
Right.
get them to keep their feet down and
Right.
have parents constantly reminding them like walk properly or walk with your foot on the ground. It's just trying to
Yes.
get the brain to to remember that the feet should be down. It shouldn't be just the toes that are up.
Yeah.
Sorry, the toes that are down and the heels that are off the ground. So yeah, reminding them over and over that put the heel down, put the heel down. And when you remind them, they'll put the heel down, but as soon as you're out of sight, they'll go back up on their toes. So yeah, it's really interesting. So we talked about physiotherapy. We talked about the stretches. We talked about shoe modification. Another thing that can be done is casting. So the kids can be put in casts like the cast someone would wear when they have a broken bone on their leg. So and those are put with their feet completely in 90 degrees, and then they're told.
So you almost like you're pressing the foot backwards, more or less, to stretch the Achilles tendon. Okay.
Yes. So and that helps to, and then you told them to walk on the cast. So they have like shoes they're wearing with their cast, and they're walking with that. And as they're doing that, you're hopefully trying to break the cycle and trying to enforce the thing of walking down. We're hoping that by the time they come out of the cast, the brain has noted and learned that the foot should be down. And in a way, when they're in the cast, because they're not actively using their muscles, their cups weaken a little bit, and so when they come out of sometimes they're a bit too weak to go up, and then they'll stay down. But sometimes after that period, they'll still go back up on their toes.
Go back. So you can end up with a relapse, and you get back.
Yeah. I don't know if I would call it a relapse, but it's actually something like that. Yes. So then they go back up on their toes, but sometimes that's all they need, and then they're good to go. And in some institutes, they do administer administer Botox to
Okay.
the calf muscles, and that's just sort of to weaken that neuromuscular region and get them to stay down, especially before the casts are put.
Right.
So if non-operative treatment has been tried and they seem to still continue to want to stay up on their toes, then another option is surgery, especially if they've now developed like contractions of their Achilles,
Right.
like if the Achilles tendon has now tightened up and it just won't come down. So
Mm.
in the surgery, what is done is you do like small cuts in the Achilles tendon or the Achilles tendon
Mm.
of the heel pod. So small cuts are made in the heel pod, and that helps stretch it out. Then they're put in
Mm.
casts for an appropriate number of weeks until the tendon is healed enough to allow them to walk out of the cast. Yeah.
How much correction can you get when you sort of do this Achilles tendon procedure to release it? Can you get back to like a normal position, or you still maybe to further stretch the foot? Because like we discussed earlier, that the moment you take the cast off or whatever, because of psychological makeup, the kids will still end up wanting to walk on their toes, and therefore you can almost lose that sort of correction that you had. So when you perform this Achilles tendon release, you get a certain amount of correction. But do you further correct it, or so that when it relapses, at least it relapses to a neutral position, or do you just kind of rely on the Achilles tendon release
So,
in that instance?
so yeah, I mean, when you do the Achilles tendon lengthening, you get it fully. You get it fully to 90 degrees. Yes.
Okay.
But this would depend at what age you find them. I mean,
Mhm.
I think if you found the child and they were, I don't know, a little older, they're 12 years old and and everything around the ankle joint has tightened. Sometimes an Achilles tendon lengthening might not suffice, so you might need a bit more release from other things like maybe the capsule around the ankle joint and any other soft tissue releases to try and get that foot down. So it depends on also how much correction you want to achieve, but very many a time analysis tendon lengthening, but done through very tiny small cuts is all that you need to get a full plantigrade foot.
Okay. I suppose the last thing that I wanted to check, Judith, is if this was left untreated, what would be the long-term implications on this child as gets into adolescence and becomes an adult? Or
Yeah,
the condition like that has been left untreated and the person is an adult and they walk on their.
sometimes they may have a relatively wide front of the foot. They tend to balance really well on their.
Okay.
So if all has been done, or if nothing was ever done, and they're walking just fine on they're walking just fine on their tiptoes, they may not have that bad effect because they're the kids I have seen who are like older and they've gone through all these treatments and nothing is changing, or they're not getting away from walking on their toes, then
Right.
let them be. They just let them be. The issue is that they wear out their shoes pretty quickly. They end up getting really the callosities at the front of the foot.
Yeah.
The stuff in the middle of the foot can really tighten, and sometimes they can get secondary deformity in the foot. And there's been also been discussions about how they can have a bit of imbalance on their toes, sorry, on their feet as they're walking, because it's not like the most favorable position. But many of them do just fine.
But could you also have like a long-term maybe arthritic conditions in the joints
The front of the
of the toes or other parts of the limbs, like in the knee or the hip, because obviously the weight of their body is not being carried by the base of the foot, like the entire foot is just one part of it. So I'm just wondering whether that could have secondary effects in terms of, arthritis in the joints.
I haven't read about that. It's
Mm,
possible. Like I think one thing that I would think would be that sometimes we could get adaptive changes in the bones because if
mhm,
some bones are working a certain way and others are not, then changes could happen over time, especially as the children get a little older.
mhm.
But about the effect of the arthritis, that I'm not sure.